Greetings, I'm Sue Houseman, the new President and CEO of Harbor Hospice and Palliative Care. Thank you for joining me today. I plan on sharing a short update on the status of our organization, our services, and response to the COVID-19 pandemic. Together with our community health partners, we have had to quickly adapt and change the way that we provide palliative care and end-of-life services for our patients and families. We continue to see patients at home, in the hospital, in facilities, and at the Leila and Cyrus Poppen Hospice residence in all of our 5 county service areas along the West Michigan lakeshore. Please rest assured that we are still here for you, providing the same expert care with compassion, comfort, and support, with our mission as our strength and foundation. We are staying updated and are following the guidance of the CDC, WHO, and our local county health departments to make sure we keep our staff, patients, and families safe through the use of social distancing, masking, sanitizing, and symptom monitoring. We continue to offer services from our entire clinical team of physicians, nurses, nurse assistants, social workers, and spiritual counselors. Very early on, we added the capability to offer virtual visits through Harbor Tele-Health if visits are not possible in person. At this time, our volunteers are not making patient visits, but have been supporting us in so many ways, including sewing homemade masks and gowns. The majority of our staff continue to work remotely. Our office is open, but visitors and vendors are restricted, and we ask if you plan to visit for business purposes to please call ahead. We've been developing a plan to bring staff back to our office safely and to re-engage our volunteers. At this time, there is no established date for this to occur, and it will largely be based on our community achieving a consistent downward trend of positive COVID cases, as well as our ability to modify our work environment in accordance with recommended safety practices. In June, we were able to allow increased visitation at the Poppen Hospice residence, up to 1 person per patient per day, due to a new state directive, which includes hospice residences and skilled nursing homes. We are now required to test our patient care staff on a weekly basis and all new patients prior to admission at the Poppen Hospice residence for COVID-19. We have, however, been caring for patients with COVID-19 in the community, primarily at home and in assisted living facilities and nursing homes. Our Bob and Merle Skolnick Healing Center is also here to meet the increased need for grief and loss support. Now, more so than ever, we are feeling loss, whether that be the loss of a loved one, employment, or being disconnected from our friends, classmates, or families. At this time, the Skolnick Healing Center is conducting individual and group sessions virtually for grief support. For more information, please tune in to the podcast on our Harbor Hospice website called Loss During COVID-19, Everyone is Grieving, by 2 of our own clinicians. I hope to provide these updates on a regular basis moving forward and encourage you to stay vigilant in your masking and social distancing. Please know that Harbor Hospice and Palliative Care is leaning in and working tirelessly to meet the needs of our community. Your journey, your terms, our expertise. Thank you.